Welcome back to Mind What Matters. Today we are talking with Dr. Sharon Malone. She is a nationally known expert in women's health and the New York Times Bestselling author of Grown Women Talk. She is the chief medical advisor at Alloy Women's Health, a telehealth company that focuses on women over 40. Before joining Alloy, Dr. Malone was a partner at one of the oldest and most successful OBGYN medical practices in Washington, D.C. She's a board certified by the American College of Obstetricians and Gynecologists and certified by the North American Menopause Society as a certified national menopause practitioner. Throughout her professional career, she has been active in advocating for reproductive rights, reducing teen pregnancy, and eliminating health disparities. Dr. Malone is the youngest of 8 children. During World War II, her parents, both of whom were raised in the rural South, moved to Mobile, Alabama during the migration from farms to cities. She has seen healthcare from both sides as a physician and a child of parents who negotiated healthcare for themselves and their families in the Jim Crow South. Despite living next door to 2 hospitals, preventative healthcare was never a part of her family's life. And as a result, Dr. Malone's mother would lose her life to colon cancer, diagnosed too late for treatment. This searing life experience has informed how Dr. Malone has chosen to practice medicine and brought focus to the healthcare issues that she has chosen to pursue. Hi.
Hi, how are you?
I'm so good. I have to be honest. As I said, we are majorly knocking the dust off the Mind What Matters podcast. This is our first one in 2 years, and I'll explain why. But I couldn't have started off with a more impressive person. I have been excited to talk to you since you said yes. And I live in Nashville. I don't know if you knew that, but there's celebrities running all over the city. And I don't think I'm ever impressed with a single one, but I'm just going to let it go off the bat that I'm fangirling big time to talk to you.
You are kind.
I just have rarely met anybody that I find as impressive as you are. I've read your whole book cover to cover, and it is such an immense amount of knowledge that you were able to put in such a comprehensive, understandable, relatable, and just kind way. I could just tell. I also listened to the audiobook after I read it, and I can just hear through your voice just the true kindness that you have for helping people, and women specifically, but for everybody. And of course, for what we do, Mind What Matters helps Alzheimer's and dementia caregivers. This is a space where these are people that just are giving everything they have to others, and they don't take care of themselves. And so from that standpoint, I just feel like there's nobody better first to tell people what to do with their own health, and to take themselves more seriously, and to take their own health so seriously while they're caring for others that they love. But I'm so impressed with you, and I'm so grateful for the work that you've done. Your story is incredible, just all your brothers and sisters, and how you really shared about your family. And I want to get into all of that, but before we started filming, I had to fangirl over you just a little bit.
Well, you are kind, and you make me very happy, because that was the whole point of the book, is really to, put it in a format that people could really access it, because I didn't want it to feel like, anyone's being chided or lectured to. It's important, and it's personal, and, so if that's the way it's received, then I'm happy.
It's definitely well received. I was telling a group of women about it recently, and I said it's literally like having, your dear friend sitting in your living room telling you how to take charge of your health. And at the end of the day, what is more important than that? It's the most important part of your life is your health. And yet, for whatever the reason, as you're a caregiver, as those years pass, you take it less and less seriously because you're focusing so much on somebody else. And one of the things, the whole reason that I started this podcast was because in 2019, there weren't a lot of people that were talking about the caregiver space. I was a young caregiver myself. I was basically starting to care for my own mother when I was about 29 or 30. And that lasted all the way through my 30s and the first half of my 40s. And I looked around and nobody else was dealing with these issues. Nobody was arguing with their parent over how to throw out old food. Their parents were babysitting and, taking trips with their kids and their grandkids. And I felt so alone. And so I really started this whole podcast and then the nonprofit afterwards as a way to find other young people that were going through this and connect us all and sort of share about our stories, share how it felt to be alone and sad and ultimately maybe even burnt out or depressed. And as the space has evolved and grown, thank the Lord, there's so much being done for caregivers now. This season on the podcast, I'm really sort of pivoting a little bit and wanting to help caregivers focus on their own health. I want them to take it as seriously as they take their caregiving job. So that's why I wanted to talk to you. Again, I just don't think there's anybody out there. There's certainly not a book I've ever read that dives so heavily into the most important parts of preventative medicine, but makes it very understandable and relatable. So I'm going to dive right in and shoot you with some questions here. Are you ready?
I'm ready.
Okay. Do you have any questions for me?
No, I think we're all good. Just tell me, I'm going to put, how long we'll just go until we're done. How about that? We'll go.
Well, I'm going to tell you what, I think I could fly to DC, move in with you, take up your guest room. I could probably stay probably through Christmas and you'd be ushering me out the door, but I still wouldn't have asked all my questions. So you kick me out when you're ready.
Well, like I said, you can always just have me back. I'm not going anywhere.
Well, be careful what you ask for. Okay. All right. So the first thing I want to ask you is what made you want to become a doctor?
Given the fact that there are no doctors in my family, I think I came to this organically. When you're a smart kid in elementary school and there were only a few paths that you could be a doctor, a lawyer, or, I didn't know any business people, so that wasn't an option. And that's sort of how it started. But I think it really solidified when my mother got ill. And my mother passed away when I was 12 years old. And I just remember thinking, as I sort of watched that whole journey and how difficult it was for her and how little I think that she knew what to do. I think she, clearly she waited too long. It was a different time. It was 53 years ago. Because, as fate would have it, today is the day that my mother died 53 years ago. And I remember thinking when she went to the hospital and, how callously, our family was treated by the doctor who operated on her. He literally walked out into the waiting room and we were all standing there, 12-year-old me and my father and one of my other sisters. And he basically just said, well, there's nothing we could do. We went in, cancer was everywhere. And so we just closed her up. And I was like, whoa, that seems, even as a 12-year-old kid, I knew that probably is not the way to deliver that news. And I think that sort of solidified in my mind that there's a way to do this and there's a way not to do this. And so as I sort of got on this road and start thinking seriously about being a doctor, I didn't just think about what being a doctor, but I really thought about what kind of doctor I wanted to be. And, and how much I really wanted patients to know that this is a therapeutic relationship. This isn't something to be feared. And I think that ultimately that's what cost my mother her life, is that, she had no real relationship with the doctor before she was deathly ill. And, if we sort of understood the importance of that, the importance of prevention, that's equally important to anything that we can do after the fact as physicians. So, long way around the block, but that's sort of it. I sort of started out, what do smart people do? And I came up with, two things. And so then after having observed what it felt like on the other side of the table, on the other side of the desk, and that just sort of helped me sort of set my North Star on what I wanted to be and the type of doctor I wanted to be.
That's a lot for any 12-year-old to take in. I actually had a similar experience. My mom and my older brother were diagnosed with cancer 2 days apart from one another when I was maybe fourth grade. So that's around 11, 12, I think. And I remember thinking, how can this just be news that you just deliver? Like how does anybody just say, oh, you have cancer? And I hate to say it, but not a lot's changed in the Alzheimer's space. We call it the diagnose and adios, but it's very similar. But that's an amazing story. And obviously I knew after reading your book what happened to your mom, but what a wonderful way to honor her and just her legacy. I'm sorry that today's the anniversary. I'm grateful to be talking to you on that special day. How do you feel all these years later? Is it still as hard as it was? Do you ever really get over the grief of losing your mom?
Never. I think that, in the hierarchy of loss, and there's a lot of them, but I think that probably, as I've talked to people, they say the hardest thing in the world is for a mother to lose a child, But I think, a really close second is a child to lose their mother. And particularly at a time when you need them the most. I was sort of just entering adolescence, and to have to navigate that space by yourself, even though I had lots of older siblings, they were much older. So they really weren't there to give me quite that motherly guidance that I needed. And you know what else that became apparent to me as, I've navigated this space and this grief for so long, is that there are only a couple of people in life that you can expect that will love you unconditionally. And I think that that's, you hope that for most people, that's your mother. And then everything else is conditional. A spouse, you'll love your children. You hope your children will love you. But that sometimes is not a given. But, I say this about navigating such a profound grief. The only thing that's different now, 53 years later, is the amount of time that I can go in between and not feel it. I can go, months, days, sometimes a year before I get back to that place again. But what I remember the most is that I remember the good things. I can still remember the lessons that my mom taught me. I was fortunate enough to have her until I was 12, so I have very clear and vivid memories of her. But there's not a day that goes by that something that I do, either for myself or for my children or how I interact, that little voice is always in my head, like, oh, what would my mother say? Or what would she do? Even the happy things. So, I understand that, and there are so many different types of grief. And I understand that, when you are dealing with a parent with Alzheimer's, it's the grief and the loss that is ongoing. And that has got to be extremely difficult to feel that you're losing someone who is physically still with you.
Yeah. Well, it definitely, I've always called it death by 1,000 paper cuts, because every little loss that you experience, whether it's the last time you've cooked together or the last time you've, gone and gotten a manicure together or just whatever it is, they're all small. But every time they lose a piece of themselves, you're losing it with them and you're watching it happen. But thanks for sharing about that. I only asked because my 1-year anniversary is coming up of when I lost my mom. And it's been, a difficult year, obviously. It's different than I thought it would be. It's grief is not linear, as they say. And, you kind of come in and out of different phases of it. My mom actually passed away as it turns out, on the same day that my older brother did. She waited for his anniversary or he came on her anniversary. I'm not sure which one I believe at this point, but it kind of makes it that much more important. But I wonder, for people that have already lost their loved ones, how different it feels over time. Everybody says with Alzheimer's, you do so much of the grieving on the front end. What can you expect on the back end? Is it as profound as when you lose a loved one in a car accident or a sudden illness or something like that? And, I think it's just different, but it's still just grief.
Right. And it's complicated because when you lose someone, either through something as protracted as Alzheimer's or even, for someone who's had a lengthy illness before they die, there's the complicated emotions that you feel. There's grief, but then there's also an element of relief, because it takes a huge emotional toll on the caregivers, whether you're taking care of, a relative for any reason, that you have to be there and be present and to watch someone suffer. It's very difficult. It's very difficult.
And then it's compounded with guilt over the relief, like how can I possibly feel relief when all I want is my parent back,
Exactly.
I think, with Alzheimer's or cancer, any major disease, death is not pretty. It's not what they make it look like in the movies. There's very seldom a day where it's your loved one lying in a bed and they're whispering last things to you. That's not what it actually looks like. This was my first time to really stare at death. And I know it won't be the last, but it's really quite ugly and it's frightening. And seeing your loved one suffer and struggle like that is, I think, for a lot of people, the relief comes from just knowing that they're at peace and knowing that it is a normal part of life. And even as hard as it is to witness, it's such a huge part of life, But let's pivot a little. We can probably go on about this. I know. And this is your mom's anniversary. This is, wow, you should warn me about that one. But I tend to go very deep, very quickly with people. So you're going to have to forgive me on that. It's a personality flaw, I think. But let's actually move into caregivers a little bit and talk about just what you said about how long that struggle goes on and how much of their own health gets neglected. And, one of the things I loved about your book was your ability to say, okay, like you broke everything down into perfect chapters of, okay, let's talk about, do you know who your doctors are? Do you know when your last mammogram was? Do you know when your last colonoscopy was? If you don't, now's the time to get a book and write it down and keep it with you always. I would love it if you could we could maybe obviously shorten it a little bit, but if you could talk about, okay, you're a woman, you're a caregiver of somebody. You could just be a caregiver of small children or of special needs children. You could be a cancer caregiver, ALS, Parkinson's, whatever it is. What is the single most important thing that women in particular and caregivers should be doing to focus on their health and prevention of major hurdles in their future so that they can sort of improve on what you called their health span, not their lifespan, but how they age? I always tell people, when you close your eyes, what do you picture when you're a grandmother? How do you want your life to be? And okay, well, you have to start today, securing that outcome for yourself. So how would you, as a physician, sit with a caregiver and tell them, okay, let's start at ground zero. This is what you should do.
You know what? It's the old airline instruction. You have to put your own oxygen mask on first, because if you don't pay attention to yourself and to give yourself some outs occasionally, because, we as women sometimes will get into that martyr complex where, okay, no one can do it but me. And, and as I say, one of the things that I do mention all the time is don't let the perfect get in the way of the good. And sometimes, yes, you might be the only person that will do it best, but is there someone that can help you out? We've really got to learn how to, even if it's not with family members, to engage others to help.
Why do we do that, by the way? Why are women such martyrs? It's like, embedded in our DNA from birth, that whole, you're right. I can do it better. I can just do it myself faster.
I'll do it. Or you're not doing it the way I would do it, so therefore I'm just going to do it. And
our husbands love that one.
I was going to say, people in our family understand that, as well. And they're saying, oh yeah, well then you do it. Okay. But here's the thing. And I tell you, one of the things that happens a lot with caregivers, and, I talk about this a lot with my friends who are still fortunate enough to still have their parents. And I listen and I hear their complaints and everything. But what happens is once you get into that caregiver role, you are constantly at the doctor's office for something or the other. It's this, I've got to take my mom for this appointment or this eye appointment. And you go to the doctor so much, you forget that, yeah, I've been to the doctor a lot, but I haven't been there for me lately,
And why would you want to?
Yeah. And that's the part where you have to really sort of stop and take, and take, a moment to say, oh, I haven't had my mammogram. I've done everything else that I'm supposed to do for everyone else. And for a lot of us, when we are in that caregiving role, oftentimes we're doing it on both ends of the spectrum. We're doing it many of us would have children in the household, and then we have elderly parents to deal with as well. And that's a lot. That's a lot. And I think that if the one piece of advice that I would give is that enlist others. We can't do everything. We're not superwomen. And I think we don't ask for help enough. And I think that when we don't, and then we're resentful because no one helped us, because we still think that, like, don't you see me? Don't you see me, running around and doing all these things? And more often than not, even people who love you, well, as long as you keep doing it, they'll allow you to keep doing it. So, so stop and take a moment and say, I need you, or I'm overwhelmed today. Even when you have, children who, and I say are not children, they're not babies, they're 13, 14 years old. You say, okay, this is a part of life. I want you to see this. And the other thing that we do is that we shield them from what's going on. And a lot of the, as you say, the ugliness of caregiving, but they need to see it. And you know what? And I can tell you, as being a 12-year-old and having seen a lot, kids can take a lot more than you think they can. And somehow protecting them isn't necessarily doing the good that you think it is. So, it's the biggest piece of advice, don't forget about yourself. Remember to sort of put in a little mental health time, however you decompress, because the message here is that chronic stress is as debilitating to your physical health as it is to your mental health. And so everybody's going to find a different path for how they relieve stress in their lives. But whatever it is, find it, practice it regularly. And, and that puts you on the path to better behaviors, such that when you get to be a certain age, and let me tell you the other thing that, you've put me on a path here, but many of us, the thing that we fear the most, when you've dealt with a parent who's on dialysis or someone who's got Alzheimer's, deep down in your heart of hearts, you think that that's your fate as well.
Oh, yes.
So the message that I give is that it doesn't have to be. And this is why I talk so much about the things on the prevention end. So you say, okay, just because I had a parent with whatever, that just gives me a signpost. It says these are what you are may have predispositions to, not necessarily what you will have. So your job is to educate yourself and to make sure that you are doing all the things on the front end that will minimize that risk as you age. And I think that in and of itself, just realizing that you have more control than you think you do is also comforting. Yeah, that's stress reliever. When you say, oh my goodness, everybody knows, if you stop smoking, your chances go down of getting lung cancer. Not that they go to zero, but they are down dramatically.
Yeah.
And the same thing is true. We tend to think of Alzheimer's as something that we don't have any control over. We do. We have more than you think.
Wait, I have to interject here. My favorite quote that you put in the whole book, it was Alice Walker said the most common way people give up their power is thinking they don't have any.
Exactly.
This is exactly what you're talking about.
Exactly.
But you do
never throw your hands in the air and go, oh, well, I guess that's what's for me. No, then that's your opportunity. That's the real opportunity for you to change the trajectory of your health journey as you age.
Yeah. Well, and there's so many ways you can do that. I mean, you take us through a whole list in your book, but let's just talk about maybe the top 5 biggest. What are the top 5 things you should do that are, perhaps the most important? Like obviously preventative medicine, get your mammograms, get your colonoscopies, stuff like that. Manage your stress. We've covered those, but what else?
They are so basic. And I say basic, whether you're talking about cancer prevention, cardiovascular disease prevention, Alzheimer's prevention, it all boils down to exercise, get a good night's sleep, eat a healthy diet, engage with have community, either the community of friends or whatever it is that you stay mentally and socially active. And then obviously things cut down on the alcohol and cigarettes. But those basic, they're so basic that people go, oh, yeah, that couldn't possibly have any effect. It does. And, and I think that we're sort of, in medicine, we're guilty of this. We spend so much time talking about diseases and we talk about things after the fact. No one really counsels you ahead of time on the things that you should do. And particularly, I think for women, and this was, when I started writing the book, it was surprising to me. And I'll tell you why it was surprising, because, I'm an OBGYN, so we do what we do. I try to make sure that young women get birth control. And if you have infertility, that you get pregnant, that you get through a pregnancy healthy, in a healthy fashion. And all of that stuff I had. But what happens, even though I did spend a lot of my time in the perimenopause and menopause space, there's sort of a gap that happens. And that the reason why we don't see in my field so many of the women as they are developing Alzheimer's or dementia and cognitive issues as they age is because we don't see them anymore. They're there. And then now they're gone. Most people, as they age, they'll come back. But there are a lot of people that once they get to a certain age, they stop coming to the gynecologist, even if they don't have dementia or cognitive issues. So I didn't really have a sense of how prevalent it was and how disproportionately it affects women. I mean, that was surprising to me.
2/3 more likely.
Yeah. I looked at, I was like, wow, 2/3 of the people with Alzheimer's in this country are women.
Okay, I have to ask the question right now because it's just the perfect time. But why? Why? I've gone through this. I mean, obviously, from what I do, I talk more about Alzheimer's and dementia than, anybody probably. But why is it that women are diagnosed so much more frequently than men? 2/3. I mean, that's an astronomical difference. And I've thought about it from every which way to Sunday. I've thought, well, they might chalk it up to estrogen loss and menopause. And obviously the whole world is talking about that right now. Finally, thank goodness. But is it also maybe just that we carry the stress of our whole family and we carry our mother's stress, our father's stress, our kids' stress, our husband's stress, Is it how much is heaped on women? I mean, to me, I don't know. Like the menopause thing, sure, although God designed our bodies and they've been menopausing since, the beginning of time. Right. Alzheimer's wasn't always this prevalent, but now all of a sudden it's 1 in 3 cases, 1 in 3 people over 65. That's just astounding.
It's a lot of things. And when I say it's a lot of things, we can tell you what it's not. Okay. And this disproportionate number of women who get Alzheimer's, it's not because we live longer. We don't live that much longer, so not that. And I think the reason why it wasn't as prevalent in generations past is because so few women actually got to the point where they didn't live long enough really after menopause for most women to develop Alzheimer's. You had a few people who lived to be 90, but for the most part, women were, generations past, the number of women who made it through menopause and beyond was a very small number. Because remember, we've made tremendous advances in things that people would have died from. Childbirth, infectious diseases, where we've done a tremendous job at maintaining people with cardiovascular diseases that they would have died from. So we've done better at extending the life of women long enough so we can see what happens in the postmenopausal years. Now, I'll tell you what, I always like to tell you what we know, and then I'll tell you what I think, because they're two different universes. But what we know is this, is that for women are disproportionately affected. Well, what's really different? What happens to women at midlife that doesn't happen to men? Menopause. Okay, well, that makes sense. Well, what we know, and a lot of this is through the work with the work from Dr. Lisa Mosconi at Weill Cornell, is that she is the first person who's really looked at how women's brains are different than men's, and how our brains are different at each phase of our reproductive lives. Our brains look a certain way in premenopause, they look a different way in perimenopause, and they get remodeled and turned into something else postmenopausally, and that's what's happening. And the only thing is happening is not just the aging, because you could compare a woman's brain to a similarly aged man, and our brains still are very different. And what is happening clearly is that hormonal fluctuation and then the hormonal loss once we get to menopause. And that's really different for us. Now, do we know whether or not estrogen, if we start estrogen early enough in our menopause transition, does that decrease the risk of Alzheimer's? Possibly. And I say possibly. This is what we think. Now, the unfortunate part of this is that, well, why, we don't know. And why don't we know? And we don't know because no one has bothered to ask the question. This is, to me, when I say when I put my big A advocacy hat on, it's for saying to the research community, to NIH, to people who are out there trying to, find cures for things, like, why have we not been curious enough to do the research to find out why this disparity exists? And for so many things, we just accept it. There is this, and I say this a lot. I said, we are indifferent to women's suffering. There are a lot of things that we don't know. Why are we getting fibroids? Why do we have more autoimmune diseases? Why do we have an uptick? Why are we disproportionately affected by depression and anxiety and irritability? All of the questions go on. But I think that for something as important as Alzheimer's, and for the opportunity that we had 30 years ago with the Women's Health Initiative, we could have had the answers to some of these questions by now. I think that it is not far-fetched to think that there is clearly a role of hormones or lack thereof in terms of how our brains are affected as we age as women. And we'll do a little backwards logic on this. But what we do know is that for women who are menopausal, either prematurely, which means that you are menopausal before the age of 40, the average age is 51 and a half, or if you are menopausal before 45, which is considered an early menopause, for any number of reasons. You could have had surgery, you could have had your ovaries out, you could have had radiation, chemotherapy, any one of those things that puts you into a premature menopause. What we do know is that if you have an early or premature menopause, it increases your risk for developing Alzheimer's. Why? Because you have been devoid of estrogen for longer than someone who went through menopause at the average or natural age of 51 and a half. Now, that's what we know.
Hang on.
Now,
so many people who you're talking about, though, like women who arguably may have had hysterectomies or maybe just their uterus out and they've kept their ovaries. But I think if you keep your ovaries, then it's not the same thing, right? Because you're still producing hormones.
You're still producing hormones, and you will still go through menopause. See, that's the thing. We think of menopause as something that only has to do with your period stopping, but no, it's the presence or absence of estrogen. So if you have a hysterectomy, ovaries are in, those ovaries will continue to function for however long they're going to function, but you will still have the symptoms and the long-term health implications of lack of estrogen, whether you have a uterus or not. So hot flashes, night sweats, mood swings, irritability, itchy skin, dry vagina, all the things that are associated with menopause.
So why do people say, oh, well, I just want to keep my ovaries? I mean, if
you can, because they will work. They will work for a period of time. So if you were 40 years old and you were having a hysterectomy for reasons you had fibroids or whatever, I'd say absolutely keep your ovaries because they're going to last. Maybe they'll last 5 years, maybe they'll last 6, but at least that's the amount of time that you have before you start to experience the symptoms of menopause.
Okay, I understand. Yeah.
So keep them if you can, and if for whatever reason you can't or you've had chemo, then we really have to say to these women, look, you can take hormones, but you should. And that is the recommendation of the American College of Obstetricians and Gynecologists and the Menopause Society, that for women who have early. So, it's sort of around the way, around the block and back, but we can use a little bit of inference because we can do that. We don't always have direct evidence for everything. And even if we did the study, if we started that study today, and we said, okay, let's look at a group of women, estrogen, no estrogen. We don't have the ability to do a randomized study because how are you going to say to someone, okay, come be in my study and you have hot flashes and night sweats and you're miserable, but I might give you a placebo. Well, guess what? You're going to know if you get a placebo. And so is the person who got the treatment. So that's why I said we have to look at more innovative ways for how to do this. And plus, we don't have 30 or 40 years to wait to see. Your researcher will be dead by the time the data comes in. So we have got to look at other things, and that's why Lisa Mosconi's work with brain scans is useful. That's why maybe identifying some of the markers that are associated with Alzheimer's, that's important, that we know how to intervene when, who's at risk, who's not at risk.
Are you talking about APOE?
Yeah, APOE. But even that is not a one-on-one, because you've got like 4 copies and 4 different ones. Okay, do you have 2 or which one? It's confusing. Mm-hmm. So I say this to say that, I think we should all come into this phase of life thinking that we're all at risk. Yes, we are, and let's do the things on the prevention front, because what is discouraging for me is that so much of the effort about Alzheimer's is based on treatment once someone is diagnosed. And the reality is we know that by the time symptoms, manifest themselves, that process has been going for 20 years, a decade, if not more. And we've got to figure out some way to intervene before we get to that point, because, regardless of what, people read, the data on the new medications out here for Alzheimer's is like, meh,
meh,
very
best.
expensive, very expensive. and for very little benefit ultimately. So
when has that not been a problem in the medical community as a whole? I mean, you have Hispanics that are 1.5 more likely to get the disease. Black people are 2 times more likely to get the disease. And these drugs are $56,000 a year, some of them 28, some. I mean, you're talking about in a large demographic of who have the disease, can barely afford to eat.
Right.
These are people who have, respite care is not even a word that gets thrown around. They're just dying for any type of help or assistance because there's no money, much less, that kind of money to throw around to medicine.
And the reality is that you don't get better, you just get worse more slowly.
Slower.
So it's like, well, yeah, great.
That'd be like an incredible marketing slogan. I think you should you could go write ads for biotin. Oh wow.
They would not like those people would not like for me to write their copy. But I'm like, but that's the truth of the matter.
That's true.
And if you understand that, then I think it should motivate people to, again, gets back to understanding that you have more control. All those things that I just talked about, sleep, diet, exercise, making sure you are engaged community, all of that stuff. That is stuff within your power to do, and I say again, and I get back to hormone therapy because I say, one of the other, the risks that we know, the risk factors, I should say, for developing Alzheimer's is women who have severe hot flashes. Women,
really?
Yes. The more severe your hot flashes, then, think about this. And none of these things you can pluck out just one at a time because one thing affects the other. Is really a domino effect. But if you have very severe hot flashes, then guess what? You don't sleep very well. Now you've got disrupted sleep. So the next day you're fatigued. You've got brain fog. You know what you don't do when you're fatigued? Exercise.
Or eat well.
Else? Yeah. You know what else you don't do when you're fatigued and you don't feel well? You make bad choices. You eat, you smoke, you drink, you are self-soothing some way or the other. All of these things, again, now what happens? Now you're gaining weight. What happens with that? Type 2 diabetes. Each and every one of those things is an independent risk factor for developing Alzheimer's. So that's why, again, run that story back and say, for women who are symptomatic, do I know for a fact that it decreases Alzheimer's? No, I do not. But I can infer, and this is, where I think that there is a decent amount of evidence that says treating hot flashes helps you sleep through the night, helps you not get type 2 diabetes. There's 20% decrease in the risk of type 2 diabetes in women who take. Wow. It helps you maintain your weight. All of these things. So you see what I mean? One builds on the other. And so it's a little too simplistic just to say, is it just the estrogen? No, it's not just the estrogen, but the estrogen is the permissive factor
to drive
that minimizes all those other things. And so, and I think that, again, the work that we've seen through Dr. Mosconi's brain scans, which is actually pretty amazing. If anyone has not seen those pictures or read her, she's got a book out now called The Menopause Brain, where she actually is like, you don't believe me? Look at it, and the areas of your brain that are not functioning optimally after menopause are the same areas of your brain that are affecting mood, memory, and temperature regulation. Everything that happens to us, how we feel ultimately, it doesn't mean anything until it's registered in your brain. So if I tell you that estrogen affects the metabolism of your brain, then that means that how you feel all over is really being affected. A hot flash is and she said it beautifully, and I probably won't say it quite as well, but a hot flash, menopause is a neurological event just as much as it is a physical event. And it has not just the things we think of menopause as being something that just has to do with your reproductive organs. And then once you're not having babies, who cares? No, it's a neurological event. And that's why we feel the way we feel. That's why as women get into perimenopause, that's why there's a huge uptick in depression and anxiety, irritability, all that stuff. And you know what? There are things that you knew, but you didn't know you knew them. But when you think about it, you go, of course, why not? Think about what happens to us hormonally as women and what is going on in our lives at that particular point in time. PMS, what's happening in PMS? It is happening because you are at a particular point in your reproductive cycle. It happens a week or so before your period when your estrogen levels start to fall. Postpartum depression, when does it happen? After you've had a pregnancy and your estrogen levels plummet. So this brain hormone connection, we know that. But why we have never really thought about that in terms of what, that brain-body connection, the brain-ovary connection, surely it happens in menopause and perimenopause. Otherwise, why are we, in perimenopause filled with rage?
Yeah, and what did doctors tell you to do too? Most of the time, there's so many women, especially like I live in the Southeast. A lot of times you're seeing a male doctor and, they're saying, oh, well, just take some Zoloft or just do this and grin and bear it. And seriously, like that's what you're told. And for so many women. And so they leave feeling discouraged and sad and like no one's listening to them. And as though they just have to get through it and just sort of white knuckle it through these tumultuous years. And unfortunately, in the 80s, I think it was the 80s maybe, that we had this big war on drugs. And every time you turned on the TV, you saw, a frying egg in a skillet, right? And look what happened. The whole world knew drugs are bad for you. Don't do drugs. Now, some people heeded that warning and others didn't. And the same was true with smoking ads and everything else. And guess what? People quit smoking. But here we are, 2024. And we know that these issues are such a serious problem for women, and not just women, but men too. You eat this way, you smoke, you drink, you have high stress, you don't stimulate your brain, you don't stay, engaged in lifelong learning or community involvement. Your chances of Alzheimer's are through the roof, APOE or not. And yet no one is educating the public about this. And it's one thing for a bunch of upper middle class white people to be sitting on Instagram and learning all of this like health and wellness stuff. But the people who it's actually affecting, you think they have time to sit on Instagram and scroll and read, oh, I should be taking magnesium at night? It's such a serious problem. Why do you think we're not addressing it on a more wide scale basis? Like, why isn't the government shouting this from the rooftops on every commercial?
Oh, that's a great question. And that is something that I have really been trying to work to get people to do. I agree. I think there should be PSAs about this.
Yeah.
We, believe it or not, I'm old enough where we used to get in cars and there were no seat belts. It wasn't like, you were choosing not to put one on. We had those big bench seats and you just sit in the back and it was like roll around in the car.
Those were great days.
You used to have to, we had to have PSAs to tell people, don't throw trash out the window when you're on a trip. The commercials with the people throwing trash out, and there was a Native American with the tear because it was like, don't litter. That's the level of engagement I think that we need to have on the prevention front. Yep. But here's the thing, and, I'll be a little bit political on this. And I say political in the sense that there's no money in prevention. We are, in this country, we have access to some of the greatest medications in the world, But who develops those medications? Who makes money on those medications? Big Pharma has a vested interest in treating you for things. They have no interest in making sure you don't get those things, And that is why I think it's going to take, sort of a grassroots, and, it's going to take NIH. It's going to take the National Cancer Institute. It needs to be, why we're not shouting from the rooftops, from the American Cancer Society, American Alzheimer's. I think that we're trying to do that to get people activated, because I think that there is the mindset. Everybody wants to take the easy way out. And it's easier to sit on the sofa and not do what you need to do because you think that there's going to be a pill for that, or there's going to be, a procedure for that. Not so much. But this I do believe, and I do believe wholeheartedly. I think people would do it if they were aware. And so our job is to increase awareness about these things. I say all the time, exercising is not about losing weight, because you don't lose weight when you exercise. That's not the point. The point is that, for all the things that we talk about, when I talk about Alzheimer's, I say, look, the same things that you do to protect your heart are the same things that you do to protect yourself and to guard against early, or untimely Alzheimer's. You live to be 100. Okay, you might have a little dementia. We'll take it.
Yeah.
But I don't want you to have it at 65 or 70, and there are things that we can do. And our job is to increase the awareness. And I think that, and again, where else does government have a role? Well, in the foods that we eat. We put warnings on cigarettes and say, hey, watch it. This stuff is going to give you cancer and heart disease and all these things.
Or prohibit them altogether, right? Like in London or in England, you can't even get half the cereal foods that you can buy in the U.S.
And again, you have to say, who does that serve? That the fact that we have people in this country that don't have access to fresh foods. We don't have access to healthy foods. You can have fast food restaurant in your neighborhood and not a grocery store that says fruits and vegetables. We make the healthy choice the difficult choice.
And more expensive choice.
Exactly. And so that, I think that's public policy. A lot of the things that we know that are problematic, we know about the social determinants of health. We know that it's important for people to have access to quality health care. We choose not to do these things. And that is, that's the harder, that's the long game that we're going to have to fight. And in the meantime, while we're waiting to get these societal changes implemented, I just want people to be aware of, okay, well, then what can I do today while I'm waiting? I may not live long enough to see medicine right itself, in terms of how we deal with patients. And, I think it will be how we interact is going to be completely different. Not even, I would say next year, 10 years from now, than the way we do now. And it's going to be much less personal. And we're going to be very much focused on disease entities and treating, and we're going to treat diseases like we do and not the individual. And we certainly don't have time to do prevention, because prevention counseling takes time.
It does.
Takes time. It's easier for me to write a prescription than for me to go through all the lifestyle implementations that you need to do.
I think, there's a small, this is going back a long way, this story I'm going to tell you, but I think you wrote, there's some part of your book where you mentioned Gayle King. Do you remember? So when I was I think I was 12 or 13, I was young. I definitely was not a teenager, but it was right after my mom and my brother had been diagnosed. And of course, my brother, lost his battle. My mom had early breast cancer. She was 39. So he had Hodgkin's disease, she had breast cancer. All I knew was 2 members of my family were sick. And I was, obviously a very scared little girl. But I was vacationing in Telluride with my dad, and who had just gotten remarried. And they had brought me along with them on their honeymoon, which was a terrible idea. I don't know why that was ever suggested, for anybody. It was not setting me up for success with my future stepmother, that's for sure. But we pulled up to the snowmobile place, and Oprah was there with Gail and Stedman, and she had this whole crew, and it was right next to our property, or my stepmom's property. And so they had rented it out, so we had to go home and, couldn't do this snowmobile tour. And I made her cookies. I made her chocolate chip cookies, and I took them back to her, a couple hours later. And I gave her these cookies, and she was obviously so touched. And, I kind of knew who Oprah was, but, so I'm sure it was mostly my parents, that thought that was super cool. And she kind of got real close. She kind of pushed my dad, my stepmom off to the side, and she looked at me and she said, who are you? Tell me about yourself. And I did. And she said, so how are you feeling about all of that? And I said, well, I'm really scared, it's my mom, and this is my older brother that's my best friend. And she said, I don't know how any of this is going to work out for you, Elizabeth. And I don't know what the end of this story is, but I know that you're going to do something beautiful with it. And I want to be around to see what that is. And I don't know what the end of my story is at this point, especially after coming through the last year of that disease. You talk about it being brutal, and it is, but that last year is just so hard, to say nothing of the actual dying part. There's just so much about the end stage of that disease it takes so much out of you. But I do know this. Some part of my story is going to be figuring out a way to get this to be a public service announcement. And whether or not the government does the right thing and helps us do that, or whether or not I figure out how to put out a podcast a day and get the whole world to listen, I just know it has to be done. And there has to be more people like you that actually care about their patients and that care about their whole story, and that weave the thread of, okay, back, when you were trying to get pregnant, you had a tough time and there were fibroids, and okay, like maybe some endometriosis, and then 10 years later, you're done having kids, and now all of a sudden the pain's coming back. Like, let's revisit what happened in your 20s and 30s. And if people can't figure out a way to have a physician that remembers all of this stuff for them, they have to do it themselves, because there's always a commonality. And, for my mom, I've often wondered if, we had no history of Alzheimer's in our family. I wonder if the radiation she got, in her late 30s had some effect. It was never as localized as it is now. Maybe that had an effect on her brain. Who knows, right? Well, but if she had one doctor instead of 15, maybe she would have had a different outcome too,
Right. I mean, I think that you're right, is that the more of us that keep talking, and the more of us that advocate for more research, for more education, I think that we will have I think that impact will grow. It will multiply, because it won't just be just you, just me.
Has to.
Even if 3 people hear it and they tell 3 more people, and it goes on and on. But I think that that's really the problem why there has been so little action, is that we just didn't know. I mean, again, I did not know when I started writing my book that that in 2022, the NIH, which is the largest funder of research, of medical research in the country, had a $45 billion budget, and less than 11% of that went to conditions and diseases that primarily or exclusively affect women. Wow. We're 51% of the population. We're probably north of 60% of the voting population. We're taxpayers. What about us? You see what I mean? So I think that, researchers are not, they're not stupid. And what they do is, if you submit a research proposal and you say, I want to study endometriosis or fibroids, and the people who review the grants go, no, not interested. Well, then guess what? There's not going to be any more research on fibroids and endometriosis. And I think that that's been the problem, is that there has not been sufficient attention paid to things that affect women. That's number one. But two, I think that it's very short-sighted to not do this because, just as we sort of look at the Alzheimer's figures, and there are about 6.5 million people in the country today who have a diagnosis of Alzheimer's, and that number by 2050 is expected to double.
Triple.
Because there are so many of us in this boomer generation and the generation behind us, Gen X, that we're the largest demographic. So, okay, who's got us? How can we afford not to address this? Because it will be crushing for the generations behind us. I have 3 children, but I'm not counting on any of them, sort of dedicating their lives to taking care of me. If I get Alzheimer's, maybe they will, maybe they won't. I don't know. But the point is that that's why I work double time to try to make sure that I'm doing all the things that make sure. Now, will something befall us? Of course. Death and disease will eventually claim us all. But all I say is, let it be not the thing that I could do something about.
Yeah.
That's my job. That's really my job to warn everybody else too. It's like, okay, let us not be that. Okay. Let's be something else. Surprise me.
Anything else? Yes, surprise me. Surprise me with something sudden, like a garbage truck. I don't know. Oh my gosh. It is 1:45. I could talk to you until, like I said, I'd move in. I'd be at your kitchen, at your breakfast table at 7 a.m. And you'd say, Elizabeth, oh my gosh, I have to have coffee first. And I'd be spouting off questions. I know I have to let you go, but I'm so honored. And I didn't even get to ask you 3/4 of the questions I wanted to. I never even asked about birth control, which is probably the largest question I got from friends and other people that I asked. Like, what would you ask this impressive, doctor about women's health? But maybe we can do another one another time about that, because there's so many other things like that. And endometriosis, which you touched on, that takes how long? I think I have it, and I still can't get a diagnosis. It's been like 7 years. So
that's about average. It takes 7 to 9 years for women to get a diagnosis, and they've been, multiple rounds to the doctors, to ERs, everything like before we get, why don't we know more about it? Why don't we study more about that? Well, that's our job. That's our big A advocacy piece of this, is for women generally to start demanding more.
Yeah. We have to demand more. And we're just starting to do that, in a way that really is finally being heard. But it's the whole, we can't be silent about it. It's not really all that dissimilar from taking a more proactive approach with your own health.
Right.
This is sort of, I'm charging all women. I have a board member, Dr. Annie Fenn. She's the Brain Health Kitchen. She's also an OBGYN, but has opened up like a cooking school for all things brain health. And she always likes to say, I like to charge people to say, go out into the world as brain health advocates, and spread all this information. But that's what we have to do. It's the only way that we're going to change things even a little. But if you know that 41% of cases of Alzheimer's are preventable with lifestyle changes, and we're not doing them, I mean, we have nobody to blame but ourselves,
That's exactly right. That's exactly right. We can do better. And I think that people will do better. Just like we made people put seatbelts on and stop throwing trash out the window, we can have people do the things, because this is an immediate concern. It's not like, oh, yeah, let's do it for the environment. No, let's do it for you.
And it doesn't just take care of Alzheimer's. It takes care of type 2 diabetes, cancers, a whole host of other issues,
Exactly.
We won't get into the mental health piece of things, but, obviously you eat better, you sleep better, your mental health's going to improve.
Yeah. So, and you know what? And don't accept suffering. That's my last message to women. It's like, if suffering is a part of life, and we all will go through things from time to time, but it shouldn't be your state of being on a day-to-day basis. No. If that's where you are, then you need to understand that there's something that you need to do to address that.
Yeah, for sure. Thank you so much. I'm so grateful. The worst thing you've ever done is give me your cell phone number, because I'm going to abuse it mercilessly.
You got it. So you call me back. We'll talk about, there'll be something else that comes up, and you just ring me up.
I'm just so incredibly grateful. You are an amazing person. I hope that you do something today, just in quiet and in solitude, that brings you close to your mom. And what little you said about her in the book, it sounds like she was a force and had quite a way with words when she needed to. But you are, from what I can tell, very, very similar. And I'm grateful to have had the time to talk to you. Thank you.
And it was a pleasure.
Thank you so much. Take good care, okay? I'm going to call you after this.
All right.
Okay, bye-bye.